Bueno, damas y caballeros, continuando con nuestra programación de Café con Leche, ya a las 7:30 de la mañana, con una temperatura de 59 grados en Lancaster y 50 grados en York. Vamos a darle inicio a este jueves a nuestro segmento sobre la diabetes, gracias a nuestros amigos de Blue Cross, Capital Blue Cross, haciendo posible este segmento. En la mañana de hoy, gracias a la colaboración que nos está dando en lograr estos segmentos a Southeast Lancaster Health Services, tenemos aquí con nosotros a la enfermera graduada Julia Sensenek, quien nos estará conversando sobre el rol importante que tienen exactamente las enfermeras en llevar hacia la comunidad, hacia el paciente, cómo manejar la salud. Julia, it's a pleasure to have you here this morning. Thank you so much
to be here.
for being with us. And I do know, even though I know that you're here thanks to Southeast Lancaster Health Services, you're really with HAC.
That's right.
In collaboration,
right.
bringing up new nurses in Southeast. Tell us a little bit about what you do on your day-to-day.
Sure. I'm an associate professor of nursing at Harrisburg Area Community College.
Mm-hmm.
So I am employed by Harrisburg Area Community College. But 10 years ago, this fall, we set up the HAC Nursing Care Center at Southeast Lancaster Health Services on South Duke Street. And at that site, we meet with patients who are struggling often with management of their diabetes, management of hypertension or high blood pressure, management of high blood cholesterol, trying to quit smoking. So we meet with patients who are referred to us by healthcare providers at one of the 3 sites of Southeast Lancaster Health Services.
And it's interesting because you're using the word management.
Right.
This is not the fact that you're discovering whether or not a patient is suffering from any of these illnesses. It's how they're handling them.
Yes, that's right.
So specifically, after the doctor has made a diagnosis, you are training these nurses to be the ones that are helping the patients go back or as close as possible to being healthy.
That's
by
right.
managing the illness.
That's right.
Talk to us in the case of diabetes. What does it mean managing diabetes?
Right. The management of diabetes includes many things. And as patients find out, once they're diagnosed with diabetes, their blood sugar tends to rise when they don't eat healthy foods, or they don't get enough exercise, or they're not active enough. We use the word activity usually rather than exercise because it's a kinder term. How do we be more active rather than how do we get exercise? But becoming more active is important, taking medications to manage their diabetes, following up with physicians' visits, their healthcare provider visits, meeting with their nurse practitioner. The patients need to become motivated to take care of their own diabetes because ultimately that falls on the patient's shoulders.
Would you say that there is a period of adaptation? You need to adapt to the diagnosis and to the fact that your life has to change.
Yes, that's right.
I mean, right now, whether you want it or not, it's you know, because we're when we're healthy, we're hearing about activity, we're hearing about eating healthy, we're hearing it all the time. But now, you have to do it, correct?
Right.
If you want to live a life free of complications from the illness.
That is so true. That is what our nursing students, the HAC nursing students, are the ones who meet with the patients. And they're students who have gone through several semesters at HAC, and they're very knowledgeable about diabetes by this point. So they talk with the patients. They help the patients who come to our nursing care center to take small steps at a time, making small adaptations first to their lifestyle, taking those steps toward better health. And it is true, though, that we recommend patients eat a healthier diet, but it's not just for patients who have diabetes. We really, truly feel it's for everyone. Those of us who don't have diabetes, to prevent getting diabetes is something that we think about and talk about. But at the Nursing Care Center, we help patients set goals for themselves. A goal may be as simple as walk around the block 2 times every day. A goal may be to switch from full cream milk to 2% milk. And then perhaps the next time the patient comes to us, we can have them switch to 1% or skim milk to lower the amount of fat in their diet, for example.
So you go step by step because it's
That's
that
right.
period of adapting to the fact that
Yes.
you've just been diagnosed.
Yes.
Now, I'm guessing that with some patients, because some may be diagnosed when they recently became diabetics, but some may have been living with diabetes for many years.
And not knowing it.
Not knowing
Mhm,
it.
mhm.
Some need to adapt a little quicker than others.
Right.
Is that correct?
That is true. Some persons have what we call intrinsic motivation. It's motivation from inside them that says, I am going to make these changes because it will benefit me. It will benefit my family. It will help me live longer, to be with my grandchildren longer. Other persons are more extrinsically motivated, meaning that their family healthcare provider has told them, you need to make these changes. These patients come to us and they say, my physician or my nurse practitioner told me to come here. What should I do? What am I supposed to do? And they look to us to tell them what to do.
They need a manual. They need an
They need a
instruction manual
manual.
to make things.
So
things
we
happen.
understand that and we go with that, but we hope eventually those patients move toward being intrinsically motivated, meaning that the motivation for change comes from within themselves. Then they are better able to make those changes and keep them.
Keep them. Bueno, conversando con la enfermera Julia Sensenik sobre el papel que tiene ella como profesora de enfermería de HAC en Southeast Lancaster Health Services, de entrenar, no solamente estar entrenando a nuevas generaciones de enfermeras y enfermeros para ser proveedores de salud, sino específicamente en el manejo de la diabetes. Y no solamente, ella habló no solamente, Héctor, de manejo de la diabetes, sino manejo de la hipertensión, manejo de tantas otras enfermedades, hasta incluso el manejo de cómo dejar de fumar.
Sí, señor.
O sea, que en este caso se está hablando de un proceso de adaptación. Cuando un paciente es diagnosticado con diabetes, hay un proceso de adaptación que quiera o no, si el punto final lo que se quiere es vivir una vida plena, sin complicaciones de la diabetes, lo que hay que hacer es adaptar la vida al diagnóstico. Y ellas están ahí para ayudar.
Me gustó el término que utilizó, en vez de decir hacer ejercicios,
aumentar la actividad.
Aumentar la actividad, porque nada más la palabra ejercicio la mete miedo a algunas personas.
Exacto, porque
¿o no?
uno piensa de una vez que tiene que ir a alzar pesas o algo así.
Exacto.
Y entonces ella dijo que en ese proceso de manejo vemos dos tipos de personas. Y yo sé exactamente de dónde estoy yo, porque cuando lo explicó, dijo, hay personas que están intrínsecamente estimuladas para los cambios y personas que necesitan estímulos extrínsecos, es decir, externos. Hay personas que dicen...
Yo soy uno de ellos.
Que necesitan externos,
Sí,
yo también.
ya.
Yo necesito estímulos externos para hacer cambios profundos en la vida, pero ellos tratan de lograr de que la persona como nosotros que necesita estímulos externos para cambiar, que logre tener internamente las ganas de hacer las cosas, porque ella dice que ahí es donde está el éxito. Que poco a poco, estableciendo metas, como simplemente decir, mira, hoy voy a darle la vuelta a la manzana 2 veces alrededor de mi casa. Esa es mi meta para la próxima cita. Mi meta para la próxima cita es ir de leche completa a leche de 2%, para después ir a 1%, para después terminar con leche descremada, para ir bajando la ingesta de grasa en la comida.
José, algo tan importante y que debo mencionar, yo he tratado de eliminar un poco estos antojitos de antes de irme a dormir. Y cuando eso sucede, el día siguiente se siente la diferencia.
I think Hector is trying to find an extrinsic stimulus to stop his before bed snacks. So he's trying to say, how would you? Yes, and we were saying that as you were explaining, we all know exactly where we are in terms of, do we need extrinsic stimulus, or are we, intrinsically motivated for change? And we both agree we need external. So this would be a program, a service that him and I, where we diagnosed with diabetes, we would need to be
Mm.
in a group. And that's my next question. Does this happen individually with each patient, or do the nurses meet with groups of patients, or is it a combination of both?
It is almost always one-on-one
Mhm.
at the Hack Nursing Care Center. We meet, and when I say one-on-one with a patient or with a family member and the patient.
Mhm.
Sometimes as many as 4 family members come at one time. Perhaps 2 children are struggling with childhood obesity, and they may come with both parents.
Mhm.
And so it's a family situation
Now,
at that
how
point.
important when managing a chronic disease as diabetes
Mhm,
is it to involve the whole family
mhm.
uh, in
Yeah.
that process?
Most people do need the support of their families to make the changes and keep the changes going in the future. They need to be accountable to someone, a family member who says, I am only going to bring home from the store the foods that are healthy for us. Or we are going
Or
to
someone
go.
else other than
Mhm.
the patient is the one in charge of cooking.
That's right. that
And,
is so
and
true.
if someone
Mhm.
doesn't stop baking the brownies,
Mhm.
the patient's not going to stop eating them,
Yes,
right?
that's right,
Yes.
that's
So
right.
it's really
Right.
an interesting situation of saying we're going to work with the whole family, because if the patient wants to eat right, but
Mhm.
the wife or the daughter or the son
Mhm.
is in culinary school and coming up with all these
That's right.
not necessarily healthy dishes is
Right.
really an interesting thing.
And setting goals around activity as well. A patient will more likely continue with the activity goals that we set with them or that they set for themselves if they involve a family member.
Even walking around the block, it's
That's
much
right.
easier if you're doing it with your spouse,
Mhm.
or pushing a stroller together or something like that.
And you feel safer
Yes.
on out.
And doing it.
Sure.
Bueno, damas y caballeros, muy interesante esa parte de que en la parte del manejo no siempre es simplemente uno a uno con el paciente, a veces uno a uno con el paciente y la familia, para que todos juntos ayuden, sean estimulantes a que el paciente cambie sus patrones. And I'm guessing, Julia, it's also very important because if dad or mom are diagnosed with an illness that has such a strong genetic component to it,
Mhm.
why not start the changes with the kids early on
Mhm.
instead of waiting until they have diabetes?
Right, right. And it's not so much that we talk with children who are tending toward obesity about losing weight, but more about eating healthier and being more active. So as they grow, their height and weight actually even
Becomes
out
more
after a
proportionate.
while.
Mhm.
So it's,
So, well, Julia, we really appreciate it. We know that this is being a healthcare provider is beyond a profession. It's a way of life. It's a philosophy of life, and
yes.
it's wonderful to
Enjoyable.
see that you're bringing new
Mhm.
generations to this wonderful profession.
Hack is a great place to go to school too.
Yes, and if there's someone out there interested
Mhm.
in becoming a nurse,
Mhm.
what should they be doing now? Probably in high school. What would you recommend?
Right. Uh, the nursing profession is very heavy on the sciences and math, so doing well in science and in math in particular is very helpful before entering the nursing program. But at HAC, a student is in a preliminary, taking a lot of prerequisite courses before they enter the nursing program, courses including anatomy and physiology and microbiology and English composition
Mhm.
and so forth. So psychology, abnormal psychology. So some of those courses, if they could be taken early on, that's very helpful.
Very helpful.
Mhm.
So there is certainly an emphasis on science and
Yes.
math.
Yes.
To
Mhm.
be and what a wonderful opportunity that we have it right here in our community to become helpers of our own
Mhm.
community. Thank you so much.
You're welcome.
Bueno, damas y caballeros, ahí lo tienen, muy importante, todos juntos, la familia junta, para hacer la motivación de ese familiar que sea diagnosticado. Y especialmente porque la diabetes, como lo hemos dicho aquí en nuestro segmento, es una enfermedad genética. Si hay un papá, una mamá que está diagnosticada con diabetes, es importante que empecemos con los niños desde tempranos. desde temprano, porque tienen más posibilidad de padecer ellos en el futuro.
Qué chévere sería decir, mi equipo en contra de la diabetes es mi familia.
Es mi familia, exactamente. De eso se trata. Y ojalá que junto con las enfermeras en Southeast Lancaster Health Services del programa de HAC, usted lo logre.
Gracias, tremenda entrevista.
Gracias a Capital Blue Cross por este segmento. Continuamos entonces después de la pausa.
Vamos a la pausa, ya volvemos, señoras y señores.